Question 1. A 62-year-old smoker presents with confusion, seizures, and hyponatremia. Serum osmolality is low, urine osmolality is high. Chest CT shows a central mass. Which hormone is most likely elevated? The correct answer is B, antidiuretic hormone. The patient is a smoker with a central lung mass in hyponatremia due to low serum osmolality and high urine osmolality, which indicates syndrome of inappropriate ADH secretion. Small cell lung carcinoma commonly produces excess ADH, leading to water retention, dilutional hyponatremia, confusion, and seizures. Choice A is incorrect because parathyroid hormone-related peptide is typically produced by squamous cell carcinoma and causes hypercalcemia, which is not seen in this patient. Choice C is not the answer because adrenocorticotropic hormone is also produced by small cell carcinoma, but it causes Cushing's syndrome, not hyponatremia. Choice D is not the answer because calcitonin is produced by medullary thyroid carcinoma, not lung cancer, and it is not associated with syndrome of inappropriate antidiuretic hormone secretion. Question 2. A 67-year-old smoker with ptosis, meiosis, and anhidrosis. Shoulder pain, weakness of hand muscles, apical lung mass on chest x-ray. What is the diagnosis? The correct answer is A, Pancoast tumor. A Pancoast tumor is a superior sulcus tumor that arises in the lung apex and commonly causes Horner syndrome due to sympathetic chain compression, along with shoulder pain and hand muscle weakness from brachial plexus involvement. Horner syndrome presents with ptosis, meiosis, and anhidrosis. Choice B is not the answer because mesothelioma is associated with asbestos exposure and presents with pleural thickening and recurrent pleural effusions, not Horner syndrome or brachial plexus involvement, and it typically appears on the pleura, not the lung apex. Choice C is incorrect because small cell lung cancer is associated with paraneoplastic syndromes such as SIADH and ACTH production, and while it can involve the mediastinum, it does not specifically cause apical lung destruction or Horner syndrome. Choice D is not the answer because thymoma arises in the anterior mediastinum and is associated with myasthenia gravis, not Horner syndrome or brachial plexus compression, and it does not present as an apical lung mass. Question 3. Which lung cancer most strongly associated with smoking? The correct answer is choice B, small cell lung carcinoma. Small cell carcinoma is the lung cancer most strongly associated with heavy smoking and typically arises centrally. It is also associated with paraneoplastic syndromes such as syndrome of inappropriate antidiuretic hormone secretion and adrenocorticotropic hormone production. Choice A is not the answer because adenocarcinoma is the most common lung cancer overall and the most common in non-smokers and women. Although it can occur in smokers, it is not the one most strongly linked to smoking. Choice C is incorrect because carcinoid tumors are neuroendocrine tumors that are usually unrelated to smoking and tend to grow slowly, often presenting with flushing, wheezing, or carcinoid syndrome in some cases. Choice D is not the answer because hamartomas are benign lung tumors composed of disorganized but mature tissue elements and are not associated with smoking or malignant transformation. Question 4. A 70-year-old man with 15 pack-year history of smoking, but who stopped smoking about 5 years ago, presents with cough and weight loss. He has evidence of left pleural effusion, Chest CT shows left upper lobe apical mass with left pleural effusion. What is the best next diagnostic test? The correct answer is choice C, fluid cytology. Pleural fluid cytology is the best initial diagnostic test when lung cancer with malignant pleural effusion is suspected. It is minimally invasive and can confirm malignant cells in the effusion, helping establish the diagnosis. Choice A is incorrect because pleural biopsy is used when cytology is negative or inconclusive. It is more invasive and not the first step when pleural effusion is present with suspected malignancy. Choice B is not the answer because adenosine deaminase testing is used to evaluate pleural effusion for tuberculosis, not lung cancer. The patient's presentation, smoking history, apical mass, weight loss, is more consistent with malignancy than TB. Choice D is not the answer because GeneXpert is also a diagnostic test for tuberculosis, not for lung cancer. While TB can present with pleural effusion, the imaging findings and smoking history point toward a malignant cause. Question 5. A 68-year-old man with a known history of lung cancer presents to the clinic with progressively worsening bone pain over the past several weeks. He also reports noticing changes in his fingers, including swelling and a rounded appearance of the nail beds. On examination, there is clear evidence of digital clubbing, and palpation reveals tenderness over long bones. Based on this clinical presentation, which type of lung cancer is most likely responsible? The correct answer is choice D, adenocarcinoma. Adenocarcinoma of the lung is associated with hypertrophic osteoarthropathy, which commonly presents with digital clubbing and painful bone changes. In a lung cancer patient who develops severe bone pain and clubbing, adenocarcinoma is the most likely subtype. Choice A is not the answer because small cell carcinoma is typically linked to paraneoplastic syndromes, such as syndrome of inappropriate antidiuretic hormone secretion and Cushing syndrome, not digital clubbing with bone pain. Mesothelioma in choice B is not the answer because mesothelioma is associated with asbestos exposure and leads to pleural thickening and effusion, not hypertrophic osteoarthropathy with clubbing as the primary finding. Choice C is not the answer because squamous cell carcinoma classically causes hypercalcemia due to parathyroid hormone-related peptide secretion rather than clubbing and painful bone changes. If you found this video helpful, don't forget to like and share it. Subscribe to the channel for regular updates on medical knowledge and skills, U.S. medical licensing, examination preparation, and other medical exam essentials.